Despite the fact that the number of women using child spacing method is at a new high, about 300 million women that are in need of this child spacing method do not have access to it simply because of limited information. Access is limited and we do not have enough information about the child spacing method. Good afternoon, Hamola Sumbo Mudupe, and this is Contraceptive Matters with DKT Nigeria. What we do basically on this show is to increase the awareness level on the use of child spacing methods, thereby reducing maternal mortality rates, making all pregnancies feel wanted. And that is what we do basically on this show. It's Contraceptive Matters with DKT Nigeria, and it's made possible by DKT Nigeria, one of the largest and private providers of contraceptives and reproductive health products in the country. I'm Olasumbo Mudupe. The program continues briefly. Please stay with us. Welcome back. It's still Contraceptive Matters with DKT Nigeria. Like I said earlier on, the number of women having access to child spacing method, modern child spacing method, is at a new high, but unfortunately, most people or most families, especially women that need access to the modern child spacing method, do not actually have what they actually want. They just go out there to pick anyone without getting informed choices, informed knowledge about the modern child spacing method. That is why we are here today. But today we are looking at something different entirely. We are looking at hormonal intrauterine system. It's another modern child spacing method. It is hormonal. It helps you space your family. It has a lot of benefits. And today on the program, we are going to weigh the side effects, how to manage the side effects, the benefits. And I have someone in the studio with me, Dr. Tosin Lale, a regular doctor in the house. Welcome to the program, doctor.
Thank you very much, Sumbo.
How are you?
I'm very well, thank you. And good afternoon, viewers at home.
Okay, to start with, what makes hormonal intrauterine system different from other types of child spacing method?
Okay, thank you very much. I'll answer that question by first of all telling us what the intrauterine system is, okay? So the intrauterine system, as she has mentioned, is hormonal. Then for short, we just call it IUS. So every time I say IUS, you know it means intrauterine system. It's hormonal, and the active ingredient in it is a progestogen hormone. That's a type of progesterone. Now, so it's an example of a hormonal contraceptive that falls under the category of progesterone-only contraceptive. And it consists of, it's just a very small plastic material. That's what it's made of, not usually longer than the length of a matchstick. Then it also contains a cylinder, which is also called the reservoir, and that's where the active ingredient is. So this ingredient is stored there, and this form of contraceptive is placed inside the uterus. That is why it is intrauterine. So in that manner, we can say it's similar to the IUCD.
I was going to ask you,
it's similar, but
are they the same?
No, they are not the same.
Why? What makes it different?
The difference lies in the fact that this contains a hormone. The IUCD contains copper, which is not a hormone produced in the body. So that is the major difference. And then
but they look the same.
They're not the same. No. The thing they share in common is the fact that they both go into the uterus, that's into the womb. They are there physically. So as I was explaining, this reservoir containing the active ingredient, it releases, the way it works is that it releases the hormone in micro amounts, just very little amounts per time. So you don't have a large amount of the active ingredient stored up in the body. So that is actually one of the advantages of this method of contraceptive, because the active ingredient is released at a small amount, at a small dose per time. You can escape the side effects that you get from other hormonals. For example, the injectables. You know, because once you take an injection, it lasts for 3 months. So it's actually a depot put in there. The dose is quite high.
And it releases.
So that it will last you for 3 months. But with this method, because it releases at a small amount per time, you actually get to avoid some side effects of a hormonal contraceptive.
If it's stored up somewhere in the device.
Yes.
So what's the expiration date?
Well, for the brand of IUS from DKT, which we call Eloira, it actually lasts for 5 years.
Okay.
Yes, so it can be there for 5 years. The active ingredient, which is called the levonorgestrel, is released at tiny amounts per day, and it can actually be there for 5 years. And it's a proven method of contraceptive, so it's suitable for women who would not remember to take a pill a day. Some women will not even remember, it's 3 months, I need to get my injection. This one will be there for 5 years, so you can be rest assured that you do not need to worry about it.
Yes. Okay, what makes that brand, DKT's brand of IUS, different?
Yes, like I explained, the major thing is the dose. The dose of the fact that the dose of the levonorgestrel that is released is just a small dose per time. So that helps us to avoid a lot of side effects that may come along with it. So that is really a strong point and a strong reason why this type is preferred over all brands.
Okay, can anyone walk up to the health center to adopt that use? What are the things you need to take into consideration before adopting that method? Okay,
like we usually say, the thing about contraceptive is that, okay, when you visit any health facility and you make your intentions known, the doctors and other health practitioners are there to guide you as what methods will be suitable for you. So basically, any woman can use the IUS. Like I said, women who will not remember to take their pills daily, women who want long-term contraceptive, like, okay, I don't want to have a child in the next 5 years, so you can adopt a long-term method. But of course, there are in certain cases, we don't advise certain women to use it. For example, women who have had breast cancer, or who have a history, or who have a tendency, because those that have a family history of breast cancer or ovarian cancers or any of that, we would not advise that they go on this method. Women with hypertension, and generally women who cannot use hormonal contraceptive because of health problems that they have. Women with chronic liver conditions, with heart disease and all of that, we usually do not advise them to adopt this method.
Okay, what about women that are treating STI, sexually transmitted infection, and all that?
Not.
Because I'm sure there are people that, apart from the fact that if you have a cancer history, you cannot use it. What are other health conditions?
Yes, like you rightly mentioned, if you have an untreated sexually transmitted disease, we do not recommend. Then if you've recently had what we call a pelvic inflammatory disease, it's also not recommended for you. And then if you also have an undiagnosed vaginal bleeding, some women just bleed in between their periods, and if the cause of this bleeding has not been traced and is not known, we do not advise that you use this method. It is best to see the doctor so that they make you go through the necessary investigations to know what the cause of this intermittent bleeding is.
Okay.
Yes.
It is similar to IUD. How do I use the intrauterine system?
Okay. Like we said, when you visit the health facility and you've been counseled and the health professionals, they have taken your history and they are sure that this method is definitely suitable, it will be inserted by an expert, somebody that has been trained professionally to put it in there for you. And once it is done by an expert, there are no worries. And the mechanism of action of this particular method is that it makes the cervical mucus, it thickens it, it makes it thick such that spermatozoa finds it very difficult to get into the uterus. It finds it difficult to swim in. Another way it works is that it also thins the inner lining. We call that the endometrial lining of the womb. So it thins it such that if at all fertilization occurs, then it will not encourage implantation. Implantation will not be able to happen. And then in a particular class of women, very few women though, this method also prevents ovulation. That means they don't release the egg at all. But this is not a usual mechanism of action for this method. But research has shown that a few women also experience this when they are on the IUS, but it's not commonly how this method works. So basically, we have thickening of the cervical mucus and thinning of the endometrial lining of the womb.
Okay,
Yes.
It's still Contraceptive Matters with DKT in Nigeria, and today we are looking at intrauterine system. It's a form of modern child spacing method. It is hormonal, and Dr. Tosin Laleye has been doing justice to that topic. She has been discussing about how to use, who can use and who cannot use intrauterine system. We take a short break now. When the program returns, we receive some SMS, because even before the start of the program, we've been receiving some WhatsApp messages. So please stay with us. The program continues shortly. Welcome back. It's still Contraceptive Matters with DKT Nigeria. It's made possible by DKT Nigeria, one of the largest private providers of contraceptives and reproductive health products in the country. And we encourage women, especially families, to make informed choices when it comes to child spacing method. You don't just go out there, keep populating the population, if I can say that. Make smart and informed choices, space your family, make informed choices. And today we are actually looking at another modern child spacing method, which is Hormonal Intrauterine System. Before we continue the program, I believe our viewers would like to participate. You can join the conversation. You can do that by sending WhatsApp messages to 080-9027-9018, 080-9027-9018. Please WhatsApp messages only. We would not receive calls on that line. I'll take the number again, 080-9027-9018. You can equally log on to www.honeyandbanana.com, www.honeyandbanana.com. There you can access different methods, different variants of child spacing method from the stable of DKT Nigeria. You can equally send your questions, if you have inquiries, your questions to DKT's RHS short code. That's our SMS short code. It is actually free of charge. You send your question to 38350 space, type your question to 38350. RHS space and type your question to 38350. So, Dr. Laleye, let's continue. What are some of the side effects? Because it has so many benefits. It helps to, prevent some of the gynecological conditions out there. So what are the side effects? I'm sure it has maybe minimal side effects.
Yeah, definitely. Okay, I've not really explained all of the benefits. So
okay, so maybe you should start with the benefits.
Yes,
then.
So like we said before, one of the very good benefits of this method, I explained earlier that the reservoir is there and the amount of hormone is released at a little amount per time. So with this method of contraceptive, you don't need to worry about when I stop this method, when will I be able to have a child. The moment it is taken out of your body, you can take in. Unlike some other methods that you may need to maybe wait for 3 to 6 months for fertility to return. So for this method, you don't need to worry about delay in return of fertility. Immediately it is taken out then. Well, if you take it out and you are not taking in a hand, there may be other reasons why that is not happening. And then another reason why this method should be preferred, or why it is preferred in women who can use it, is the fact that it's able to help treat some gynecological conditions, like for example, women who have heavy menstrual bleeding. This method actually helps to reduce the amount of bleeding they have at the end of every month, and by so doing, that will also help prevent what we call iron deficiency anemia. Anemia is when your blood level is lower than it should be, and some women have very heavy menstrual flow and actually suffer that. So this method can help prevent that. And also this method also helps to treat women who have menstrual cramps. It helps with the pain of menstruation, what we call dysmenorrhea. So women who have very painful cramps during menstruation, having this method of contraceptive actually helps in reducing the amount of pain they have. And then this method is also useful it helps to prevent conditions like endometriosis, and even for some cases of fibroid. It helps in conservative management of fibroid. Really? Yes, it's part of what it does. Not that it will make the fibroid disappear. No, that is not how it works. So because I know that a lot of people will be interested in finding out how it's used in the management of fibroids. What it does in the management of fibroids is that with fibroids, like I explained earlier about heavy bleeding and cramps, women who have fibroids have very heavy menstrual bleeds, and they have painful menstrual bleeds too. So with this method in place, it will help with the amount of bleeding they have, and it will also help with the cramps they have. But I must also add that this method is only useful for small fibroids, not for fibroids that are already very large. Okay. No. No. So please don't let us, don't hold me that I said it's used to. Yes, so I just needed to explain that clearly. For very small fibroids, it can help with managing the symptoms that the person suffering the fibroids may have. So besides all of these benefits, there are also side effects. So some of the side effects, some women may complain of discomfort in the pelvic area, especially when the intrauterine system is newly, yes, definitely, you know, it's a foreign body. So it will take the body a while to adjust to it. So some women complain of cramps, but those can be treated easily with over-the-counter painkillers or analgesics and all. And then some women, a lot of women will experience a reduced flow or a reduction in their menstrual flow. You know, I explained that the mechanism of action is that it thins the endometrial lining. And what happens at menstruation is that the lining of the endometrium that would have been built up in readiness for implantation, for a baby to be implanted, that is what, if pregnancy doesn't now occur, that is what is the, that's what becomes the menses at the end of the month. So it flows out. So if this method works by thinning that endometrial lining, then you can expect that the flow at the end of the month will be very little. So for some women, it may just even be spotting, and in very few women, it doesn't even come at all. So that is one of the things. There's no cause for alarm. Like I said, the womb gets ready to receive a baby, so it prepares lining upon lining upon lining, and if a baby doesn't come, and then all of it gets dissolved, and that is what flows out. So if you are using a method that is supposed to prevent a baby from coming, don't be surprised that there's really nothing don't be surprised that nothing flows out at the end of the month.
We'll talk about the myth. I think that belongs to the area of myth.
It's not accumulating anywhere. It's just the way the method works.
The myth because of the
so
program.
Some women may have spotting, intermittent spotting, and then some little discomfort in the pelvic region. Nothing major to worry about.
Okay, so we don't have any other major side effects.
No, nothing.
Okay. Yeah. Okay, we have a message already. Please, what are the side effects of this 2-month injection? What's the 2-month injection?
Okay, that's also an that's an example of a progesterone only contraceptive. Okay. So like I think we talked about that a couple of weeks back. Yes. So some of the side effects, like we discussed then, change in weight, which may be an increase or a decrease in weight. Some women may experience that. Then one of the major things that a lot of women complain about is the menses may initially be irregular. Some women will have bleeds in between, but like we tried to clarify about 2 weeks ago, spotting is not the same thing as bleeding. So for some women, it's just spotting that they experience. And we said then that within 3 to 6 months, these things will settle, because it takes the body some time to adjust to whatever it is that is new that you have introduced to it. So you may have bleeds in between, so your menses may become irregular. And for some women, by the time the body fully settles, the menses may not even come at all. So that is, and that I know is one of the major side effects about the injectables that a lot of women worry about. I'm on this method and I'm not seeing my menses. Why am I not seeing it? So that is the major side effect. Then minor ones like headache, which you can easily use over-the-counter contraceptives for. And then after a while, 3 to 6 months, these things get to settle and
the body gets used to it. Okay, sometimes we have the IUC shakes from its position, so no one needs to use hand to shape it. Sometimes bleeding occurs. I think the message is incomplete. Do you understand that?
Well, I'm trying to get that.
It occurs this to I think what the viewer is trying to know is if truly the IUC shakes from its position, what happens? Okay,
what I will say about that is that usually, like I was explaining before, the cylindrical part and the reservoir that is inserted into the womb, there is usually 2 threads, sometimes a thread, or for this method we are talking about 2 small threads left that will come out through the vagina that the woman can actually feel. So you can feel it with your hand, and it's advised that after your usual monthly period, you should just try to feel for that thread to be sure that it is there. Yes, it is true. Sometimes it may be dislodged. most times it happens right after menses. You know, it has to do with blood flow, so that may make it shift. So all you need to do, by the time it is inserted, yeah, I can see that it's on the screen, a thread, yes. So you just constantly need to feel for that thread at the end of each menstrual flow to be sure that the thread is still there. Anytime you're unable to feel the thread, please go back to the hospital or the family planning clinic where you got it inserted, so that the professionals can check to make sure that it is still in place, because it could actually get dislodged, especially after your monthly menstrual flow.
Okay, a female that did coil family planning, that's the IUD, for 4 years, is it necessary for any medical checkup?
Well,
it's been 4 years.
Well, like I said, some of these, for the IUD, some of them are for 5 years, some are even for as long as 10 years.
10 years.
Yeah, so it depends. If you begin to feel uncomfortable, or you just need to be reassured that it's still in place, why not? You can walk into your family planning clinic and just discuss with the professionals and just let them confirm to you that it's still there and it's still in place.
Okay, good afternoon, doctor. Please, I want to ask, the substance inside the tube, it's a drug, right? And is it the drug that causes the mechanism of action? That's...
Yes, it's
What
a drug.
drug is
It
that?
is a drug. It's a hormone, but it's a drug because it's the synthetic version of it. It's not what the body produces naturally, but the body also produces that hormone naturally. Like I said, is a progestogen hormone. So, but this is the synthetic version. So, in a way, yes, it is a drug, and every drug has its own mechanism of action. Mechanism of action simply means how it works, and that's what I've explained earlier. How it works is simply by thickening the cervical, the secretion from the cervix, that's the cervical mucus. It makes it too thick for spermatozoa to freely swim in, and it also thins out the inner lining of the womb so that it will not encourage implantation.
Okay, I just gave birth about 3 months ago, and my husband is demanding for intercourse. I'm scared of pregnancy. What can I do? Okay,
like we usually educate on this program, you can actually get on several contraceptive methods 6 weeks after the delivery of your baby. There are just a few methods, okay, at least, for example, the combined oral contraceptive. That's an example of the one you need to wait till 6 months after delivery before you can. But most of these other methods, after 6 weeks of delivery, you can actually pick up one of them. So I would just advise that you visit your clinic, either where you had your baby or any family planning clinic around you, to discuss with the health professionals, and by the time they take your health history and all, they will be able to advise accordingly to the best suitable method for you.
Okay, what are the other non-contraceptive benefits of IUS?
Okay, thank you. Like I've actually said some of them, so I will just be highlighting them once again. One of the non-contraceptive benefits is the fact that it helps to prevent heavy menstrual bleeding, what we call menorrhagia. So for women who have very heavy bleeding, when they adopt this method, it helps to reduce the amount of flow they have. And for women who have menstrual cramps, very painful menstruation, it also helps in reducing that. And I also said too that it's useful in helping to treat the symptoms of small fibroids. That's another non-contraceptive use. And it helps to also prevent other gynecological conditions like endometriosis in a woman. And then for some women, it actually also helps to prevent pelvic inflammatory disease. Yes, so and then ultimately, by helping to prevent the amount of bleeding a woman will have per month, it helps to prevent anemia in most women.
Okay.
So those are some of the non-contraceptive benefits.
All right, thank you, doctor. It's still Contraceptive Matters with DKT Nigeria, and we've been discussing intrauterine system, the hormonal modern method of child spacing method, and Dr. Laleye has been doing justice to that. She has been addressing the side effects, the other benefits, both the contraceptive benefits and the non-contraceptive benefits. And you can call us after the break on 0908-729-6673. I'm sure viewers have 1 or 2 questions to ask. You can participate. Share your thought with us on 0908-729-6673. 0908-729-6673. We take a short break now. When we return, the program continues. Please stay with us. Welcome back. It's still Contraceptive Matters with DKT Nigeria, and I'm Olasumbo Modupe, and Dr. Tosin Lale and I will been discussing about intrauterine systems. It's a modern child spacing method, and viewers at home have also been contributing through the WhatsApp messages, and you can equally call right now. Call 0908-729-6673. Please reduce the volume of your TV set. Please do not increase it, and make your questions or inquiries brief as possible, because we have lots of people trying to call in. Hello, good afternoon.
Hello?
Hello, good afternoon. Welcome to Contraceptive Matters.
Hello, good afternoon.
Good afternoon. What's your name, please?
I'm calling from Ikorodu.
Amo, thanks for calling. What's your question?
What I want to ask concerning this thing that you are showing now, this program, this family planning.
Okay.
I see coin. So the coin, as I was looking at the program now, they said it reduces the flooding of the building.
Okay.
Something will reduce, the blood will reduce.
Yes.
But now, I find out that I have a heavy menstruation.
Okay.
And I've done it for 5 years, for 7 years before, so I'm changing.
Oh.
So I did another one now, about a year now. So I still have the same heavy blood.
Okay.
So I don't know what happened.
All right. Thank you. But Amo, hello Amo, are you still there?
I'm here now.
Okay. Like, how many pads do you use a day to start with?
How many words?
How many sanitary pads or sanitary towels do you use a day?
Okay, if I see my period.
Yes.
Yes, like now, I always use this thing. If I want to take toilet roll, I will take like 2 toilet roll with maybe
Okay, that's fine. That's fine.
Okay.
Okay,
That's all,
thank you.
Amo. Thank you. I think the doctor needs to get that. That was why I asked how many sanitary towels you use a day. Thank you, Amo, for calling. Okay.
Thank you very much. I wouldn't know when she joined the program. She said she's been on the call. What we are discussing today is not actually the call. What she's talking about is the IUCD,
Yes.
which can actually have the effect of heavy menstrual flow. But what we are talking about today is the IUS, the intrauterine system, the hormonal. But what she's talking about, the coil, is not hormonal. That's the copper T, most likely. That's what she's talking about. So that method actually has that side effect for some women. Some women may experience heavy menstrual bleed. So it's not the same. For this method, this one works by thinning down the endometrial lining, so you have reduced menstrual flow at the end of the day.
Okay.
So there are two different
but
things.
But if she's using a sanitary wear and a sanitary towel and about two roll of tissues,
well, if
you are that bleeding,
and that's the thing, she's using tissue. I really cannot, I don't know what type of tissue and all of that, but if you are bleeding heavily and it's giving you concern, I think you need to see your doctors. You may need to switch methods for something that will cause less bleeding and will be more suitable for you.
Okay, please, what is the cure for UTI? That's urinary tract infection.
Thank you very much for that question. Well, in the first place, I would like to know, how did you find out that you have a urinary tract infection? Because this is a condition that will be diagnosed after a doctor has seen you, gotten your symptoms, then he will request for a test, most likely a culture of your urine, microscopy culture and sensitivity of your urine before they can arrive at that. And you will need to undergo the test, and it is the result of the test that will determine what antibiotics will be effective in curing that condition. So it's not just something I can say on air, okay, this is the cure. So please see a health practitioner, see a doctor for proper diagnosis and adequate treatment if you actually have a UTI.
Okay. Afternoon, ma. Can someone okay, we've read that. Please, what is the effect on... Okay, let's receive that call before we read the messages. Hello, good afternoon.
Good morning.
Good afternoon. What's your name, please?
My name is Kemi.
Kemi. Where are you calling from, Kemi?
I'm calling from Satellite.
Satellite Town. Okay, Kemi, welcome to the show. What's your question?
What about the person that, what age person can use
Hello, Kemi.
Okay.
We didn't get that.
I think she said what age?
What age person can start using this?
Okay, you want to know who can use it and at what age?
I want to ask, maybe it's working between menopause or not.
Okay.
It's
okay.
working.
If a woman at a menopause age can use contraceptive, that is what she wants to know.
Well, I wouldn't. Well, initially she said she wants to know from what age. Actually, any woman can use, even women who have not had any children at all. If they so decide, if they feel they are not yet ready to have children, you can use it. And well, when you're already at menopause, you really don't need contraceptive, because menopause is that age when you will no longer be seeing your menses, you will no longer be releasing any egg and all of that. So women of menopausal age, women who have actually attained menopause, have no use for contraceptives. So if that's what she meant to ask.
Okay. What always causes miscarriage in women?
Wow. Miscarriages have very many different causes. So it's not, and well, if I wouldn't know why you sent this in, maybe you've been having miscarriages, maybe recurrent miscarriages, I will advise that you visit the hospital and see your doctors. One of the commonest causes of miscarriages is usually for babies that have defects in birth, abnormalities in birth. That is one of the commonest causes of miscarriages or abortions. But for your case, if you're having it, I wouldn't know. So you need to please see a doctor to undergo proper investigations. There are very many other reasons why a woman may suffer a miscarriage. So please see your doctor and let them fully examine you and investigate you to know the real cause.
Hello, good afternoon. Hello, good afternoon. Hello, good afternoon. Hello. Hello. Oh, I think we lost that. Okay, what is the effect on one's sexual activities? Will it reduce your sexual drive?
Oh, thank you for that question. No, the answer is no. This method of contraceptive does not actually, it doesn't affect...
Please, doctor, hold your thought. Hello, good afternoon. Hello, good afternoon. Hello. Hello, are you there?
I think
we lost that call. Okay, so...
Yes, so this method doesn't actually reduce your sexual drive, which we call the libido. So that is one of the advantages that we get from using this method. You don't need to worry that you won't feel like having sex. No, it doesn't affect libido.
Okay,
Yes.
talking about the some of the myths, we've had cases. Hello, I think we have a call. Hello, hello, good afternoon. Hello, good afternoon. Hello, hello.
I don't think she can hear us.
Hear you.
Oh,
Good
okay.
afternoon. What's your name? Welcome to the program.
Good afternoon.
Yes, speak
Good
up.
afternoon.
What's your name, please?
My name is Blessing.
Okay.
Blessing. Thank you for calling. Blessing. What's your question? Go ahead. Hello, Blessing. Are you there? Blessing, you don't want to bless us today with your question. Okay, I think Blessing should try and call back. Let's talk about some myths. Let's dispel some myths. We've had cases where some viewers asked in the past, they want to truly know if the blood, since you're not bleeding, they want to know if the blood is storing up somewhere.
Okay. Like I explained, the mechanism of action, that is how this method works, is that it thins out the endometrial lining. That's the inner lining of the womb. And it's that lining that flows out at the end of every month as the menstrual flow. So if what is being lined up is very thin, you should expect that your flow will be very little. So it's not that the flow is storing up anywhere. No, not at all.
Okay. Hello, good afternoon. Hello? 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 Okay. Another myth. We've had cases where some viewers said the device, once the device is missing, that means, it has, ruptured your womb, or it's somewhere hiding somewhere in your body.
Okay. Thank you very much. The thing about it is that I wouldn't say that there are no cases at all of. So that's actually, yes, of the IUS getting missing from the, but they are not common at all. They are not common at all. In fact, one study I read talked about having that happen in 3 out of 1,000 women.
Okay.
3 out of 1,000 women. So the chances of that occurring are very, very slim. And that is why it is important to have this thing placed in by a professional. If you go to a quack to get it done, then this can happen. But as long as it is done by a professional, you don't need to worry at all about it being wrongly placed or perforating the womb and getting into the pelvic cavity.
Okay, thank you so much, Dr. Tosin Laleye. This is where we say thank you on the show. I'm sure our viewers
You're
at home
welcome.
actually learned a lot. I'm all called in from Ikorodu, Kemi, Blessing, and some other calls. We received so many messages today. Please, if you were unable to call in today, you can equally send your question to DKT's short code. It's actually a toll-free line. Send your question to 38350, RHS space your question to 38350. Type RHS space your question to 38350. You can also visit www.anianbanana.com or call 090-8729-0809 027901. For the RHS short code, once you send in your question, a doctor is always on standby to pick your calls, to receive your calls. So feel free to call, feel free to learn more about the smart choices out there. Make smart choices, be sharp, make informed choices for you and your family, for yourself. Let's join hands to reduce maternal mortality rate. Let's join hands to have the wanted pregnancies, not the unwanted pregnancies out there. I'm Olasumbo Modupe, and we've been discussing intrauterine system. Please join us again next week when we bring you more interesting topics about modern contraceptives. I'm Olasumbo Modupe. Thank you so much for watching, and enjoy the rest of the weekend.